Hi, I'm Charlotte Marquis. I'm an anesthesiologist, and today we're going to be talking about medication withdrawal. So, what are some reasons that we might think about withdrawing medications in the perioperative period? Well, I guess that depends. So, when we think about medications that we're giving to dogs and cats, we need to think about the impact that they might have on things like blood pressure, coagulation, fluid balance, and things like that. So if we have medications that typically affect that, we might want to think about discontinuing or doing dose adjustments of those medications during that time before surgery. So a couple reasons we might think about that: to minimize changes in blood pressure, including heart rate, fluid volume, and rhythm. So if you have medications like diuretics or if you have medications that might change the heart's rhythm, those are things we might have to discontinue prior to surgery. To allow for a normal stress response. So normally it would be necessary that the body's producing a certain amount of stress hormones, things like cortisol, catecholamines, so norepinephrine, epinephrine, that are going to help make the blood pressure good and also help make the heart pump effectively. So sometimes during anesthesia, we're going to give medications that suppress that stress response. So it is important, if the pet is on other medications that change that we think about dose adjustment there as well. Normalizing the blood glucose or the blood sugar. So if you have pets that either have difficulty controlling their blood sugar, like they're a diabetic, or they're on medications that might either lower or raise the blood sugar, we do need to think about either stopping those or adjusting the doses. And then promoting normal coagulation. So there are lots of medications that I could give a pet or an owner could give a pet that might inhibit things like platelet function or platelet clumping. So those are some of the most common. But there are other medications which on a small level might change that too. So if your pet is getting a surgery that involves maybe some risk of bleeding, we might need to think about adjusting those medications in the perioperative period. Now, that being said, this is, of course, not a complete list. These are definitely the biggest things that I think about, and I'm hoping that you will think about as well. Now, I do want to say that I have a disclaimer for this talk. So it is April of 2025. And what I will say is that when it comes to medication withdrawal in dogs and cats is that there is no list. There is no universal list with hardcore evidence supporting each choice. So there are certain papers that have come out in different journals which have recommendations, and I try to base my practice based on that. But in terms of a long list with definitive evidence, we just do not have that for dogs and cats. So this list is going to depend on who you ask, the patient, the medications you have available in the situation with the owner. So that is something very important to keep in mind. We do have a lot of these lists in human medicine, so some of those recommendations I have taken from that, but just so you know. There's going to be variability depending on who you ask. And really the best thing to do if you want to know which medication I should stop, continue, increase, decrease, talk to your veterinarian, because that situation is going to depend on each pet and each situation. I'll talk about that more later. So I guess without further ado, what are some medications that you maybe off the bat should think about discontinuing or stopping in the perioperative period? So again, this is based on what I practice, so things that I see all the time. There are medications I haven't listed here, which could be on that list too. But mostly what I'm talking about is a length of time. So we might need 24 hours, we might need 1 week, we might need 2 weeks, and some medications you continue right up until the time. So just talk to your doctor. At least 2 weeks out. So when I talk about 2 weeks out, I'm talking about medications that maybe have really long half-lives, medications that the pet is taking every single day that last for a while, even when they stop taking them just for 1 day. So things like behavior modifying drugs and anti-anxiety, antidepressive agents. So tricyclic antidepressants, SSRIs, SNRIs, and MAOIs, so amine oxidase inhibitors. So these are medications that might be used for behavior modifying in dogs and cats and in people. Typically, I would recommend 1 to 2 weeks out for these if they are irreversible, so to speak. Some of these medications can result in arrhythmias, which is something we can see under general anesthesia, might be exacerbated or made worse, could make the blood pressure a little worse. So typically I would recommend discontinuing those at that time. About 1 week out, what should we think about here? So medications for hyperadrenocorticism, so things like trilostane. So in an animal with Cushing's, we might put them on trilostane for everyday therapy. But what we do want to happen is that when a pet is under anesthesia, we want the body to be able to mount a stress response. So we want to make sure that the body is able to do that. So we would typically discontinue trilostane 5 to 7 days out from surgery if we have the opportunity. And then other things I like to think about at that 5 to 7 day period are usually things that inhibit platelets. So medications like aspirin, clopidogrel, warfarin. Warfarin does not necessarily inhibit platelets, but things that inhibit coagulation in any format, we would typically want to try in that period. And then you're looking at medications in that 24-hour period. So are there things I can continue up until the day before? NSAIDs, this is hotly debated. So some people say you should be discontinuing NSAIDs in that 1 week prior period. And some people think it's okay up until 24 hours prior to the procedure. One of the reasons why this might be is that some NSAIDs do inhibit platelet function, so that might be a concern for bleeding. The other thing is that if you have a medication that is metabolized in the liver and excreted through the kidneys, there is always going to be the risk for what's called an idiosyncratic reaction. So you could have injury to the liver or to the kidneys. And some people worry that with the stress of anesthesia, with those medications on top of that, might make that extra worse. There's really no way for us to know what is safe in that situation. What I like to say is that if the pet is hydrated, healthy, eating, drinking, I think it's okay. If you think there's going to be a great risk of blood loss, then maybe I would hold off. But again, we don't have a strong recommendation on that, okay? It's just based on clinical experience and your clinical judgment of the patient at the time. Discontinuing 24 hours, ACE inhibitors. This is a pretty big one, at least for me in my practice. So we will typically give animals ACE inhibitors for treatment of things like proteinuria or hypertension, or in treatment of heart failure. So one of the reasons I want them to be off the ACE inhibitor is that it can really make the blood pressure a whole lot lower. And with the added stress of anesthesia, it can make the blood pressure very, very low. And I feel like that predisposes animals to getting things like liver and kidney injury, more than, say, giving an NSAID within 24 hours of surgery does, at least in my clinical experience of 7 years. So that's just a short list for me. Again, talk to your veterinarian, talk to your friendly neighborhood anesthesiologist, but those would probably be the big things to keep out for. Now, just like with every treatment plan, there are going to be exceptions to that rule, okay? So this is why it's so important to have a conversation with someone before you just go into this. Heart failure patients. So generally speaking, I want heart failure patients to be taking all of their medications up until the time of planned surgery. So that includes things like diuretics, antiarrhythmics, and pro-contractility drugs. So generally speaking, I think that's okay for them. I think some people have some concerns about giving diuretics during the anesthetic period. But if you have a patient where their primary disease says that they really need that medication, then I would treat that disease, because without treatment of that disease, that would actually make the anesthesia kind of harder to do. Diabetics. So lots of diabetics are on insulin because they do not make their own insulin. So we need to supplement that to them. I am okay if diabetics get their insulin, but we need to be checking the blood sugar. So typically before a planned anesthesia or surgery, the pet is fasted, so they do not get food. And this is to reduce the risk of vomiting and regurgitation during that anesthetic period. Now, Typically, a diabetic will have high blood sugar, we'll feed them and give them insulin, and the blood sugar will come down again. But what happens if the pet doesn't get food? If the pet doesn't get food, they shouldn't also get insulin. And that means that the blood sugar may still be high. So what I like to do is that I will fast them for maybe 4 to 6 hours. I'll check their blood sugar first thing in the morning, and then I'll treat it as needed. If the blood sugar is, in the 200s, I typically don't give them insulin. If it's 300 to 400, I might give them a half of their regular dose. If it's above 500, I might give them a full dose. And then I will continue to recheck it every 30 minutes to 60 minutes as they need. And then you can kind of adjust with either more insulin or dextrose supplementation. But that is the key there. You just need to keep checking it. Chemotherapy. I'm fine if patients come in on chemotherapy. I generally find that tends not to be too big of a deal in terms of things that impair